My name's Mary Dowdall. I'm the Child and Youth Special Needs Manager for Vancouver Coastal and North Fraser. And I'm just going to talk today about the services that families with special needs children are eligible for the ministry. In order to be eligible for child and youth with special needs, there's three criteria. You can be eligible through the at-home program, which is a program for children who are physically dependent. You'd be eligible for at-home respite, which would be up to $2,800 a year of direct funding. And you'd also be eligible for medical benefits. And then another way to be eligible for this Child and Youth Special Needs program is through the Autism program. If your child is under 6, you get $22,000 worth of funding a year. And if your child is over 6, it's $6,000 of funding a year. And that's done through Victoria, and you purchase a behavior consultation, you can purchase behavior interventionists, you can purchase speech language, different types of therapies to help your child who's to reach their full potential.
Right.
And then the third way is to be eligible for Child and Youth with Special Needs program is through having a diagnosis of an intellectual disability. We do encourage families, especially during 15, 16, to get involved with us, whether the child's going to go to supported employment or whether the child is going to go to a college program or just a post-school experience. Parents sometimes experience, well, the child's in high school, the child's doing really well, the child has some peers, 9 to 3 is filled up, and our life is pretty full. Come 19, things stop. So it really is important with children with special needs to ensure that that transition is as smooth as possible. And what does your child want to do? And involving that child in those decisions is really important. We have lots of supported employment programs. There's college programs children can access. There's volunteer experiences.
They've been used to this school system, which is this entitlement. This is different in that they've got to contact you. You are not going to contact them.
It can be through the doctors, it can be through the schools, it can be through supported child development. The ministry has many different programs. They have supported child development, infant development. A child as young as 4 or 5 can be referred to us. A child as old as 16 and 17 can be referred to us. It can come from anywhere, the referral. We work quite closely with CLBC to ensure that the transition is as smooth as possible. Once you have the assessment, then you would bring that to your Child and Youth Special Needs office, and we have offices all throughout our province.
Is it simply a matter of picking up the phone and saying, I'm ready, can you expect it on Monday? How does that all work?
We do have waiting lists for our services, and some communities only a family might receive a child care worker only for a year. To try address those waiting lists to ensure that there is turnaround. And we're really focusing on community inclusion, goal focus, whether it's bus training or money management or preparing your child to get a job. All children with special needs should develop social networks, should develop peer relationships, and sometimes they need help doing that, whether it's through getting a child care worker to create social opportunities for that child to develop friends. When a family comes into an office and a CYSN worker is assigned to them, the CYSN worker will go over all the different services that family is eligible for.
What happens if the parent makes a meeting with you, comes to your office? What does it look like?
First of all, I think if they make a meeting with us, we'd phone them and let them know what assessments they needed to bring in to determine eligibility. And then we would sit down with them, and they would be assigned a worker, and then we'd sit down with them and go over what their child's needs are, but also trying to get them involved in community. Getting families to think about creating social networks for their children and friendships.
They not necessarily be put into special needs programs, but they can be put into all sorts of things in community.
And there is a real move for community inclusion. I think there's a lot of employers that are looking at hiring individuals with special needs.
You put them in contact with other things that are going on.
Yeah, we have service providers that the ministry contracts with. We put the parents in contact with them, and then that service provider would connect with the parents.
With 3 of the cases of the kids that we're tracking, they've graduated from high school at 18. They don't qualify for CLBC services until they're 19. What happens in those situations?
MCFD works with families until that child is 19 and supports that family until the child is 19. That has happened. Where we have worked with the school system to still have a school program, but it's more in community as opposed to necessarily in the school system. So I think that's key, is really understanding that what does this child want for their life? Trying to match that with supporting that child
Right.
to attain some of those goals.
Mm-hmm.